Someone asked me recently, what are some healthcare jobs I can get right now without going to college? I thought that's a great question, so I wanted to make this video. Everyone tells you that if you want a stable career, especially in healthcare, you need to go to college for 4 years, spend 4 years getting that degree and, potentially racking up, student debt. A lot of the times that's not the case anymore unless you want to go into specific fields. But in this video, I want to give you 5 easy entry-level healthcare jobs that don't require a 4-year degree, and they're jobs in hospitals, clinics, and they're hiring right now. They're not going anywhere as healthcare usually keeps growing. So plus, I'll give you ways to move up in that career down the road. So the best part is you can get started in most of these roles in less than a year, and some actually require 0 formal training at all. So landing that first healthcare job is one of the most secure, bulletproof industries that you can find. To make that happen, you've got to know which beginner jobs are actually open right now and what skills they want from you. So these aren't just random jobs that I found online. They're going to be more specialized roles that require some training, some hands-on experience, and some real skills that healthcare facilities value every single day. So I went to college for athletic training, but here's the truth. Most of these jobs don't really need that kind of commitment. So you can get into healthcare way faster, start building your future without drowning in a lot of the student loans or sitting through a lot of the classes. So here's the best part of a lot of these. So jobs open doors everywhere. So once you're in the healthcare system, you can switch between hospitals, move into different specialties, and climb that ladder over time. So the good news about this is you're probably not going to be stuck at one place doing one thing forever. So let's dive right in. So number one is going to be medical assistants. Medical assistants typically work in clinics, doctors' offices, and outpatient centers, doing a mix of hands-on patient care and office work. So you're going to be checking for things like vital signs, blood pressure, heart rate, and temperature. You're going to be getting patients ready for exams, updating medical records in the computer system, booking appointments, handling referrals, and helping the doctors during procedures. This role keeps many medical offices running. So without medical assistants, clinics would completely fall apart. Doctors count on you to keep patients moving through, handle paperwork correctly, and make sure that everything is set before they walk into the exam room. You're also the person patients see the most, so you're meeting them at check-in, answering their questions, putting them at ease, and connecting with them at the door. Healthcare facilities keep popping up, more patients keep coming in, and every clinic needs multiple medical assistants working at once. So the demand never really stops. And as people get older and need regular medical care, the need for medical assistants really just keeps on growing. You're looking at reliable work in an industry that doesn't tank when the economy does. Most medical assistants pay between $24 and $28 an hour starting out, and you can get certified in just 6 to 12 months through a trade school or community college. Some programs even let you do the coursework online with hands-on clinical hours at the end, and some places may even hire you without a certification and train you themselves. Especially if you're good with people and ready to learn, they'll show you how to take vitals, use their electronic record system, and handle everything else day to day. It's one of the fastest ways to break into healthcare, start making decent money, and see if you want to go further into nursing, physician assistant programs, or other medical roles later on. And if you find out you love working with patients, you can use your medical assistant experience to get into nursing school or focus on specific areas like heart care, kids, or skin conditions. So the second job we've got is a phlebotomist. So phlebotomists draw blood. That's really what the job is. So you're going to be collecting blood samples from patients for lab tests, transfusions, research, or blood donations. So you're going to work in hospitals, testing labs, blood donation centers, or even mobile blood drive trucks. Every single day, thousands of blood samples have to be collected, labeled right, and sent off for analysis. So this isn't going to be going anywhere. As long as we're diagnosing diseases, tracking patient health, and running lab tests, we need people who can draw blood safely and quickly. Doctors can't figure out what's wrong without blood work most of the times. They need those lab results to spot infections, check cholesterol, track diabetes, test for anemia, and catch diseases early. None of that happens without a phlebotomist pulling the sample first. Phlebotomy is one of those skills that makes you useful across the entire healthcare system. Hospitals always need phlebotomists. Labs always need phlebotomists. Clinics always need phlebotomists. What you're going to be looking at is around 24 to 30 an hour starting out, and certification programs usually take 4 to 8 months. Some programs are even faster if you go full-time. You'll learn proper blood draw methods, infection control, how to talk to patients, and how to work with tricky veins. And once you've got that certification, you can work pretty much anywhere. You've got job security, flexible schedules, and the freedom to switch between facilities if you want something new. It's a direct path into healthcare that doesn't eat up years of your life, and it puts you face to face with patients every single day. You're also picking up skills that is really specialized. Not everyone can draw blood well, especially with patients with tiny veins, nervous patients, or little kids. So the better you get at it, the more valuable you are. And if you're someone who likes routine, structure, and knowing exactly what your days are gonna look like, phlebotomy nails that down perfectly. So you're not dealing with emergency situations, emergency room chaos, or the wild unpredictability of nursing. You've got a clear job, you got to do it well, and move to the next patient. So now let's jump to number 3, medical device sales. So the third entry-level healthcare job that'll continue to be in demand and doesn't need a college degree is medical device sales. Medical devices like implants, surgical tools, and equipment. So you're teaching surgeons about new products, standing in the operating room during procedures, and managing inventory and building relationships with healthcare providers. So this job's different from the others on the list, since it's a sales role, but it's totally doable for you if you know how to market yourself and network in the right way. I'm going to be proof of that because, I went to college and did the athletic training route. Anatomy definitely helped me, but, I didn't have any previous sales experience. So it definitely wasn't the main reason of why I got the job. What mattered more was my ability to follow up with people and, do what I had to do in order to get the role. I networked like my life depended on it, reached out to a ton of reps on LinkedIn and ended up getting into the industry. I showed my current boss that I, had exactly what it took or whatever he was looking for in order to get in. Medical sales isn't going anywhere because healthcare tech keeps getting better, and there's always a new implant to learn, a new surgical tool hitting the market, or new equipment rolling out. And companies need reps who can teach doctors how to use it all and be there during surgery. So surgeons are going to lean on you to be the expert in the room. If any question or complication comes up, you are the go-to on how to handle it. They count on you to be the expert, and if you've got questions about product specs and surgery, you're going to be the go-to guy. So you're the call person. Typically the money starts around 60 to 70, but it does climb fast. So once you've got your territory dialed in, you're hitting your goals, you can clear 6 figures within a couple years or even at the end of 1 typically. So a lot of people in the field can even pull up to $300,000 a year. Here's the tricky part though, you can't just fire off applications like you could in another job. You have to build actual relationships and prove you're willing to put in the work. But once you're in, you've got one of the highest paying entry-level healthcare jobs out there, and you're making a genuine impact on patient outcomes every single day. You could be in the operating room watching a surgery, using your company's implants to help someone walk again, or you're supporting a heart procedure that saved someone's life. So that's what makes this job worth it. Definitely not just about the paycheck, but it is a part about being something that matters. So if you want to break into medical sales fast, the CourseCareers way, which is the course that I developed, could be a good way to teach you the skills to get into that. So I do teach that course, so we know exactly what it takes to get you in. We've seen people get in just 5 to 10 weeks. So we even built the free intro course for you if you were thinking about it. I'll drop that link down there as well. It can hopefully get you a job in medical device sales with no experience. Number 4 is going to be surgical technologist. So surg techs work right in the operating room, so you're getting the OR ready before surgery kicks off, setting out surgical instruments and passing equipment and tools to surgeons. So you keep the procedures going and keep everything sterile the whole time. So surgeons count on surg techs to know what's coming next, keep everything running smoothly, and make sure the operating room flows perfectly from start to finish. So if a surgeon needs a certain retractor, clamp, or suture, you're handing it over before they even say anything. You know how the surgery moves, you get the procedure, and you're always one step ahead. So this role matters because every single surgery needs one. Bone surgeries, heart surgeries, brain surgeries, routine procedures, doesn't matter what it is, there's a surgical tech in that room making sure that it's all set. As more people get older, more surgeries happen, and the need for good surgical techs just keeps climbing. So hospitals can't do surgeries without them. So you're also the one that's protecting the sterile field, which is huge for any surgery. So infections are one of the biggest dangers in surgical procedures. So surgical techs are the main defense against that. So they typically start around 25 to 35 an hour, and you'll need to finish a certification program that takes about 12 to 24 months. months. So some programs run through community college, others through trade schools, but once you're certified, you've got a pretty solid job and good job security with it. So it is hands-on, high-pressure work. If you want to dig deeper, you can zero in on a specific type of surgery, a specific niche. Each area has its own methods and procedures, and getting really good at one makes you even more in demand. So it's one of the best healthcare jobs because you're right in the middle of the life-changing procedures every single day. You're in the room when someone gets a new hip and can finally walk pain-free. You're helping with heart surgeries that will literally save lives, and the kind of impact you're having if you're someone who loves fast-paced, intense work environments is amazing. So this job would fit perfectly for you. Every day brings something different. Every surgery is going to throw you new challenges, and you're never going to be around bored. So let's get to the last one, which is a patient care technician. So the fifth and final job we're going to go over is patient care tech. They work in hospitals, long-term facilities. So you're going to be checking vital signs, helping patients with everyday stuff like bathing and eating, and helping with movement, and letting nurses know if anything changes with patients. So this is a core role in healthcare. PCTs are the ones spending the most time with patients, making sure they're comfortable and safe getting what they need. Hospitals always need patient care techs. Nurses can only cover so many patients, and PCTs plug that gap by handling that, hands-on care that keeps the patient stable and on the mend. So you're the person checking on the patients every hour, making sure they're not hurting, helping them to the bathroom, repositioning them to avoid bed sores, and keeping them clean and comfortable. So nurses depend on you to be their backup. If a patient's condition shifts, if their vital signs look a little weird, if they're showing any trouble, you're the one who catches it first and tells the nurse right away. So patient care techs usually make between 23 and 29 an hour, and what you will need could vary. So some hospitals might hire you with a high school diploma and teach you everything on the job. Others want a certified nursing assistant certification, which you can knock out in 4 to 12 weeks. So this job puts you face-to-face with patients, gives you real clinical experience, and sets you up perfectly if you want to become a nurse or jump into other healthcare roles. So a bunch of people start as PCTs, work for a year or two, and then apply to nursing school. And by that point, they've already got hands-on experience, know how hospitals work, and they're miles ahead of the nursing students who have never been in a clinical setting. So it is one of the easiest way to break into healthcare and start making money and figure out where you want your career to head from there. And if you find out you love working directly with patients, you can stick with this role, focus on specific units like ICU or emergency, and build a long-term solid career. So there you have it. Those are the 5 entry-level healthcare jobs you can land without a 4-year degree that are going to stay in demand for years to come. So medical assistant, phlebotomist, medical device sales, surgical tech, and patient care tech. If you want to get into healthcare, these are the pathways that could be hiring for it right now without the need to go to the 4-year degree. A lot of them will have on-the-job training, and you won't have to have, a lot of the student loan debt that might come with it. So healthcare is one of the most rock-solid industries out there, I think. It's a good way to move up and land a career that lasts. If medical device sales brought your attention and you want to learn more about breaking into it, check out the free intro course that I'm going to be putting in down below for it. That's what I work on specifically. Hospitals aren't disappearing, clinics aren't going to be shutting down. So the demand for healthcare workers is really only climbing. And if you get in now, you're going to be setting yourself up for a career that lasts, and you'll start seeing all the other paths that you can take. So you might start as an MA and realize you want to become a nurse. You might start as a patient care tech and decide you want to go into physical therapy. These opportunities typically show up when you're already in the system and you have a little bit more of that experience. So if you want to see more stuff like this, hit the subscribe button, and I will see you in the next video.